Actually, no, let's do the close-up of the arteries first. If Devon, our floor manager, can show us right there.
So here's what I wanted to demonstrate, that this is a magnification of the same area that was blocked in the femoral artery. And what it's really showing is this is your quasi-normal. You've got some atherosclerosis built up here on the upper part of the artery. And what you're seeing now, further down the line, this artery now becomes occluded or closed or very narrowed. So blood flow does not go through there. So it's now forced to go around the other collateral or the other bypasses. So that inhibits the blood flow down to the limb. In fact, I think this is a perfect opportunity to talk about, what we do sometimes, occasionally, is actually blow this up with a balloon or angioplasty or a stent to reestablish the blood flow.
And doctor, this can be very serious, right? I mean, in this kind of situation, if you have this PAD and you're suffering from this, are you at risk for maybe a heart attack?
This is a very good question. I think this is the critical point. If anything that we want our viewers to learn today, it's very simple. Once you've been diagnosed with peripheral arterial disease, you should be treated and thought of as having widespread atherosclerosis through the rest of your body, right? It makes sense that if you have it already built up in your legs, you likely have it in your coronary arteries, and you have it in the arteries that feed your brain, so you are likely a risk of a stroke or a heart attack. So that is the time to take into action and aggressively treat the patient as if the patient had already heart disease.
And two quick questions before we take a break, doctor. Is this gender related, and does age play a factor here?
It is not really gender related. More commonly diagnosed in males.
Okay.
Okay. Usually males are diagnosed about 10 years earlier than women, but it happens in both men and women.
All right.
Equally.
And when it comes to age?
And when it comes to age, obviously, the older we get, the more likely we are to develop atherosclerosis, and therefore we're also most likely to develop the peripheral arterial disease. But that is not a rule. There are other patients who are younger that have cholesterol issues or heavy smokers. They can develop it earlier in life. If the patient has diabetes, they tend to develop peripheral arterial disease about 10 years earlier than a patient that doesn't have diabetes.